Q1. What is the primary function of the conducting portion dot of the respiratory system? A. Gas exchange. B. Filtering, humidifying, and warming air. C. Producing surfactant. D. Blood oxygenation. Correct answer: B. Filtering, humidifying, and warming air. Explanation: the conducting portion includes the nose, pharynx, larynx, trachea, and bronchi. These structures do not participate in gas exchange, but rather prepare the air by cleaning, moistening, and warming it before it reaches the alveoli in the lungs. Q2. In which part of the respiratory system does gas exchange primarily occur? A. Bronchi. B. Alveoli. C. Trachea. D. Nasal cavity. Correct answer: B. Alveoli. Explanation: alveoli are the terminal air sacs of the lungs where oxygen diffuses into the blood and carbon dioxide diffuses out, aided by close contact with pulmonary capillaries. Q3. Which structure controls speech by regulating the opening and closing of the glottis? A. Lungs. B. Vocal cords. C. Diaphragm. D. Larynx. Correct answer: D. Larynx. Explanation: the larynx contains the vocal cords and the glottis. Speech involves the controlled passage of exhaled air through the glottis, which opens and closes using the laryngeal muscles. Q4. Which structure carries urine from the kidneys to the urinary bladder? A. Urethra. B. Renal pelvis. C. Ureters. D. Collecting ducts. Correct answer: C. Ureters. Explanation: ureters are muscular tubes that transport urine from the kidneys to the bladder using peristaltic waves. Q5. Which of the following is not a function of the kidneys? A. Acid-base balance. B. Blood pressure regulation. C. Sperm production. D. Electrolyte balance. Correct answer: C. Sperm production. Explanation: the kidneys help regulate pH, blood pressure, and electrolytes, but sperm production is the function of the testes, part of the male reproductive system. Q6. Which of the following does not contribute to seminal fluid? A. Prostate gland. B. Bulbourethral glands. C. Seminal vesicles. D. Epididymis. Correct answer: D. Epididymis. Explanation: the epididymis stores and matures sperm but does not produce fluid. The glands, prostate, seminal vesicles, and bulbourethral produce the fluid part of semen. Q7. Where does fertilization of the oocyte usually occur? A. Ovary. B. Vagina. C. Ampulla of the uterine tube. D. Uterus. Correct answer: C. Ampulla of the uterine tube. Explanation: the ampulla is the widest and most common site within the uterine tube where sperm meets the oocyte and fertilization occurs. Q8. What is a distinguishing feature of endocrine glands? A. They secrete enzymes into ducts. B. They filter hormones through lymph nodes. C. They secrete hormones directly into blood circulation. D. They are always connected to the nervous system. Correct answer: C. They secrete hormones directly into blood circulation. Explanation: endocrine glands are ductless and release hormones directly into the bloodstream to reach target cells throughout the body. Q9. Which of the following is considered a pure endocrine organ? A. Pancreas, B. Hypothalamus, C. Liver, D. Thyroid gland. Correct answer: D. Thyroid gland. Explanation: pure endocrine organs include the thyroid, pituitary, adrenal, pineal, and parathyroid glands. Organs like pancreas and liver have mixed functions. Q10. Which layer of the skin is avascular and composed of keratinized stratified squamous epithelium? A. Dermis, B. Epidermis, C. Hypodermis, D. Endoderm. Correct answer: B. Epidermis. Explanation: the epidermis is the outermost layer of skin, avascular, and develops from ectoderm. It provides protection and contains keratinized cells. Q11. Which of the following is not a function of the integumentary system? A. Vitamin D production, B. Blood filtration, C. Protection and sensation, D. Temperature regulation. Correct answer: B. Blood filtration. Explanation: blood filtration is a function of the kidneys, not the skin. The skin functions in protection, sensation, temperature regulation, and vitamin D synthesis. Q12. What is the primary function of the sweat glands? A. Hormone production, B. Immune response, C. Excretion and body temperature regulation, D. Vitamin C storage. Correct answer: C. Excretion and body temperature regulation. Explanation: sweat glands excrete water and electrolytes, aiding in temperature control through evaporation. Q13. Where is the metaphysis located in a long bone? A. Only at the epiphyseal plate, B. Between the diaphysis and epiphysis, C. At the bone marrow center, D. Within the periosteum. Correct answer: B. Between the diaphysis and epiphysis. Explanation: the metaphysis is the growing area of the bone during development and is located between the diaphysis shaft and epiphysis ends. Q14. What is the role of osteoclasts in bone physiology? A. Synthesizing new bone matrix, B. Producing red blood cells, C. Resorbing and remodeling bone, D. Transporting calcium into bone. Correct answer: C. Resorbing and remodeling bone. Explanation: osteoclasts break down bone tissue during remodeling and help maintain calcium homeostasis. Osteoblasts, in contrast, build new bone. Q15. What is the difference between osteomalacia and osteopenia? A. Osteomalacia is genetic. Osteopenia is inflammatory. B. Osteomalacia involves increased bone density. C. Osteomalacia is due to failed calcification. Osteopenia is reduced bone mass. D. Osteomalacia affects cartilage. Osteopenia affects nerves. Correct answer: C. Osteomalacia is due to failed calcification. Osteopenia is reduced bone mass. Explanation. Osteomalacia is softening of bones due to poor dot mineralization, while osteopenia is general low bone mass. Q16. Osteoporosis is primarily due to A. Increased bone formation, B. Defective cartilage production, C. Bone resorption exceeding bone formation, D. High calcium intake. Correct answer, C. Bone resorption exceeding bone formation. Explanation. Osteoporosis occurs when osteoclast activity exceeds osteoblast activity, reducing bone mass. Q17. Osteopetrosis is best described as A. Decreased bone formation, B. High bone turnover, C. Abnormally dense bone with obliterated marrow, D. A vascular bone necrosis. Correct answer, C. Abnormally dense bone with obliterated marrow. Explanation. Osteopetrosis involves defective bone resorption, leading to dense bones and reduced marrow space. Q18. According to Hilton's law, the nerve that supplies a joint also supplies colon. A, neighboring arteries, B, opposing muscles, only C, skin over the moving bone and muscles that move the joint, D, bone marrow only. Correct answer, C, skin over the moving bone and muscles that move the joint. Explanation. Hilton's law relates to coordinated innervation of joints, their movers, and overlying skin. Q19. Which is true about osteoarthritis? A. It's an autoimmune disease. B. It primarily affects synovial membranes. C. It is non-inflammatory and degenerative. D. It commonly affects children. Correct answer, C. It is non-inflammatory and degenerative. Explanation. Osteoarthritis involves cartilage degeneration and bony outgrowth without autoimmune inflammation. Q20. What is the primary cause of rheumatoid arthritis? A. Bacterial infection, B. Mechanical joint overuse, C. Autoimmune attack on synovial membranes, D. Hormonal imbalance. Correct answer, C. Autoimmune attack on synovial membranes. Explanation. Rheumatoid arthritis is an autoimmune inflammatory disease targeting joints. Q21. Gout is caused by deposition of A. Calcium oxalate, B. Cholesterol crystals, C. Uric acid crystals, D. Magnesium phosphate. Correct answer, C. Uric acid crystals. Explanation. Gout results from hyperuricemia, leading to uric acid crystal accumulation in joints. Q22. Which of the following is characteristic of ALS? A. Autoimmune demyelination, B. Voluntary muscle degeneration, C. Involuntary muscle spasms only, D. Increased motor control. Correct answer, B. Voluntary muscle degeneration. Explanation. ALS causes degeneration of motor neurons, leading to muscle weakness and atrophy. Q23. Which of the following is part of the peripheral nervous system? A. Brain. B. Spinal cord. C. Spinal nerves and cranial nerves. D. Cerebellum. Correct answer, C. Spinal nerves and cranial nerves. Explanation: the PNS includes 12 cranial nerves, 31 spinal nerves, and ganglia outside CNS. Q24. Which cells form myelin in the CNS and PNS, respectively? A. Oligodendrocytes and astrocytes. B. Schwann cells and astrocytes. C. Schwann cells and oligodendrocytes. D. Oligodendrocytes and Schwann cells. Correct answer, D. Oligodendrocytes and Schwann cells. Explanation: CNS myelin is produced by oligodendrocytes. PNS myelin is formed by Schwann cells. Q25. The parasympathetic division of the ANS is mainly responsible for A. Emergency response. B. Energy consumption. C. Voluntary muscle control. D. Homeostasis and energy conservation. Correct answer, D. Homeostasis and energy conservation. Explanation: the parasympathetic system controls rest, digestion, and body maintenance. Rest and digest. Thank you for watching.